The truth about saturated fat. Is it healthy? Is it not healthy? Does it increase your risk of heart disease? First study I want to talk about is out of the American Journal of Clinical Nutrition, big, huge meta-analysis, over 350,000 people that they looked at. They looked at saturated fat content, and what they found was that there was no relationship between the amount of saturated fat somebody consumed and their risk of coronary heart disease and coronary vascular disease. So the risk of strokes, heart disease, all that kind of stuff. So no relationship. The second study I want to talk about is a Japanese study. It was on Japanese men in particular, and they looked at these men for over basically about a 14-year period, 58,000 men, and what they showed was that the higher saturated fat content had no increased risk, so those who had higher saturated fat levels, no increased risk in coronary heart disease, and they actually had an inverse risk, meaning a lower risk of developing a stroke or some sort of cerebrovascular disease. So in a sense, that sort of study needs to be looked at closely if we're thinking saturated fat is bad for heart disease, right? Is if it increases our risk of heart disease, because it actually showed that it didn't increase your risk of heart disease, but it actually improved, it actually reduced your risk of developing a stroke.